I'm wondering, just thinking about the specifics of how the disease progresses in each patient, how do genetics maybe play a role in disease progression and even reaction to treatment?
Yeah, so what we know is that cytogenetics, it plays a major role when you're not only looking at prognostics and you're having that discussion with your patient and saying, hey, you have a worse disease process than someone who does not have these abnormal cytogenetics, but also it tells you how they're going to respond to treatment. And so when we're looking at the data and having these discussions, I can say, hey, I'm going to give a patient, for instance, um, a quadruplet therapy, and they have these bad players. They have the 17p deletions, and things of that sort. And we see that these patients, although they still do well, they do not do as well as one who does not have abnormalities. What we can say is that they don't have as much of a sustained or MRD, MRD that's sustained in comparison to someone who does not have the bad cytogenetics. So I think cytogenetics matters. I think it trumps everything. And so when you're kind of making these decisions, that's how you are making the decision whether to do a quadruplet versus a triplet therapy. It's making the decision on whether to do a transplant. Does this patient have any high risk players where they need to actually go to transplant or not?
Mhm. Are there any factors that you say would make someone more likely to have kind of these bad cytogenetic related outcomes or progression? Is there anything that we're seeing just as far as trends of what may correlate?
No, I think you know we are learning more and more about the cytogenetics, but we can't necessarily say that, hey, why are you developing this mutation in comparison to someone else not developing this mutation? We're not seeing trends in like economic burden or societal norms that is making someone have, a bad player versus not. I think, the epigenetics, all of those things are still ongoing research is needed. And I think maybe over time we may see that.
Hmm. And then just as far as when you think about setting us up for research in the future as well, when we think about things like epigenetics, some of these unanswered questions about what makes people more likely to have these, mutations, how do you see the participation or maybe lack thereof in certain populations in clinical trials playing a role in our ability to find these answers?
Ooh, I think that is a extremely important thing that, of course, we need to improve on. And I love to see that even the community practices are um, being more participatory in clinical trial research. As we know, for instance, minorities, are by far the lowest participants in clinical trial research when the average percentage of patients enrolling is roughly about 2%. Okay. That is changing where we're starting to see, for instance, even an advanced trial, I think there was about 10% of the patients who were minorities who were actually enrolled. And so I think, there's been a push to do more research in minority health and especially when we see that some of these patients are the more affected, and so I think in the future, that is a big push, and I think that we'll see some improvement.